Finally, as you may have also seen today, we announced that the administration is looking at options to share American-made AstraZeneca vaccine doses during the next few months. Given the strong portfolio of vaccines that the United States has already authorized and available in large quantity, and that is available in large quantities, including two-dose vaccines and one-dose vaccine, and given AstraZeneca is not authorized for use in the United States, we do not need to use AstraZeneca in our fight against COVID over the next few months. Before any AstraZeneca doses are shipped from the United States, the FDA will confirm any such doses meet its expectations for product quality. This is being done in the context of the FDA's ongoing review of all doses made at the plant where these AstraZeneca doses were produced. And I anticipate in the near future, our team will share more details about our planning and who will be receiving doses from here, but we're in the planning process at this point in time. Josh, go ahead.
Thanks, Jen. Let's go to India and what they're dealing with the coronavirus. The president just spoke with the Prime Minister of India. Can you give us some more details about that? And in terms of how many supplies, what are we really going to rush out there? What's the volume and the scale to deal with the problem?
Sure. Well, as Josh noted, and you may have all seen the readout that we just put out, but just in case you didn't, the President spoke today with Prime Minister Modi of India, committing that the United States and India will continue to work closely together in the fight against COVID. The President pledged America's steadfast ongoing support for the people of India who have been impacted by the recent surge in the COVID-19 cases. In response, we have provided, and let me give you more of a specific update, and I will also note for you that there'll be an additional call later this afternoon that will provide additional details. So this is just what is available at this point in time of what is being requested and what we are providing. So there are a number of areas that are of great interest and are great need to India at this point in time. Oxygen is one of them. At India's request, we are exploring options to provide oxygen and related supplies. The Department of Defense and USAID are pursuing options to provide oxygen generation systems. We may be in a position to reroute shipments planned for other countries with lower immediate needs, given the urgency of the conditions in India, and we'll have more details, hopefully, on the possibility soon. DoD is also exploring providing field oxygen generation systems, which we have used in our field medical hospitals. Each unit can provide oxygen for up to 50 to 100 beds. And we're also exploring options to provide oxygen concentrators and ventilators and are in technical discussions with India to ensure the equipment we supply can connect to Indian devices. The United States has already provided 200 ventilators to India last year and trained medical professionals on their use. So this is, of course, in addition to that and other assistance we've provided. Another one of the major needs is PPE. And we've identified U.S. commercial suppliers as well, and I should say, and therapeutics and tests, but we've identified U.S. commercial suppliers of remdesivir that are immediately available to help relieve the suffering of COVID-19 patients in India. We've identified rapid diagnostic testing supplies, personal protective equipment, and additional ventilators available to be transferred to India immediately. And I noted, of course, we also, of course, are in close touch with India officials at all levels about the raw material needs that they have. And as requested by India, we will provide raw materials for the production of AstraZeneca Covishield vaccine at Serum Institute of India. I know some of these have been announced, but that's just a little bit of additional details. So we're in ongoing discussions about what their needs are and how we can meet them.